Hello and welcome to this presentation. This is the importance of identifying your patient's spinal ligament injuries while also improving your own marketability. My name is Dr. Scott Tauber and I am the Chief Clinical Advisor. Let's start off with spinal imaging diagnostics. Every day providers are missing critical traumatic PI-related injuries as well as the underlying pain generator for chronic spinal pain. And when that happens, patients are misdiagnosed, underdiagnosed, and undiagnosed. The reason why? Because many providers are either not looking for this injury or they're utilizing antiquated or insufficient technology. We want to welcome you to the new standard in spinal diagnostics. But before we share that with you, let's just do a quick review about spinal ligaments. We already know that these ligaments support and keep our spine in alignment. However, they can get overstretched in trauma such as a motor vehicle crash or other forms of trauma. This can lead to chronic neck and lower back pain even after the patient's trauma, their personal injury, or even sports-related injury. And over time, this creates adjacent segment disease. It literally takes less force to injure a ligament than it does the disc. And yet many providers still only look for the disc as a pain generator. This is what a damaged ligament looks like under an electron microscope. On the left is normal and on the right is unstable. When your patients have this type of ligament with this injury in the spine, it creates an instability leading to chronic pain and possible long-term degeneration. Now your patients, the symptoms that they're going to present with can include any or all of these. And especially after a trauma, it could be headaches, neck and lower back pain, muscle stiffness or weakness, restriction of motion, and even extremity tingling and numbness. These are all very common after a motor vehicle crash. And again, these can be either one or all, and this could also be indicative of the spinal ligament injury and instability. Now, for most providers, the typical protocol is patient presents, and after the initial history and examination or evaluation, they may move on to x-rays or radiographs. In order to identify this particular injury, however, they need flexion and extension radiographs. Unfortunately, radiographs are uncontrolled patient movement. You already know as a provider watching this presentation that when you ask a patient to flex or extend, they're going to move, or they may not give you a full effort. And especially in the lumbar spine, asking them to bend over at the waist or bend backwards, this creates the possibility of missing injuries, and it's not reliable, it's not consistent, and unfortunately, it's not as accurate. If you're sending your patients for an MRI is not going to evaluate a spinal ligament instability either, because you already know that an MRI is motionless. And in order to identify this injury, we need a motion test. So neither one of these are accurate or as reliable as the new technology that you're going to see that now can identify spinal ligament injuries in a very high level. Now, if you are sending for MRIs and looking for disc, let me just make you aware of this. In the area of a disc injury, whether it's a bulge, prolapse, or herniation, the spinal ligament needs to be evaluated as well to help add case value and to provide documentation, objective evidence, and causation of the disc injury. Ligament damage or ligament injury is a forever injury. It still requires care, palliative and curative treatment and care, but it is something that the patient is going to have to deal with forever. Now, there are treatments that are available, and we'll discuss that in just a minute. Now, if you weren't aware, flexion and extension views or radiographs are significant. Every year, approximately 4 million flexion and extension tests are ordered in the United States as the primary diagnostic for detecting spinal instability. However, that is the old way of evaluating, and that technology hasn't changed for many, many, many years. But now there's a way to help your patients by improving diagnosis specificity, identifying spinal ligament instability accurately and consistently, improving your own patient care and personal injury case outcomes, and improving the med-legal case outcomes if you're working with personal injury patients. You also have the opportunity to evaluate for this injury with chronic spinal pain patients, athletic injuries, and others as well. The new spinal diagnostic imaging gold standard is called vertebral motion analysis. And here's why you should refer your patients for this testing in your area. It gives you the ability to see the spine in real time, which is unique to VMA, and X-ray and MRI can't do that. It identifies, it objectifies, and it quantifies this injury. It's unbiased and independent, and the evaluation and validation are done outside your office, which is critical if you're doing any personal injury cases. So even if you're evaluating in your office using flexion and extension, and you're the one doing the evaluation and the validation, that severely limits the results because you're the one doing the tests and also doing the behind the scenes as well. You should also know the technology is FDA cleared, patented, and proprietary. Here's an example. On the left, you can see a video. In the middle, you see the patient with the markups, and this is a significant injury that would otherwise be missed. On the right are this patient's results, 3.5 and 3.6 at those particular cervical levels. That's significant for anyone who's working with this patient's spine, whether you're a pain management provider, chiropractor, physical therapist, orthopedist, neurosurgeon. This is information that you need and want in order to get better case results and outcomes for your patients. And it's been called extremely valuable technology and the best way to demonstrate an instability lesion, much better than 2 to 3 X-rays. And that's directly from a medical neuroradiologist. Here's another one that is for the lumbar spine. Here we have 4.0 and 4.3, and you can see over there on the right that this patient has a significant ligament instability in the lumbar spine. But also note in that far right column, 9.0 millimeters. That person's worst ligament is also their best disc. And even 2 millimeters, even though in this particular case it doesn't reach the threshold in the lumbar spine for permanency, even 2 millimeters is significant in flexion and extension. And the same goes for the cervical region as well. Even if it doesn't hit that 3.5 permanency level in the cervical region, 2 millimeters is still significant. When you send in for a VMA testing, you not only get the raw data and also the video of the patient from start to finish, but you'll also get a written report. Multiple written reports, in fact, and one of those written reports is from an outside independent neuroradiologist. The data is read and validated, and in addition to the raw data and the video, you also get the independent neuroradiologist report to either review with your patient or present to a personal injury attorney if that's the case. Now here are the differences between the VMA technology and MRI and X-ray. And let me be clear, if you're thinking that this is DMX and that you've seen this before, the chances are, number one, you haven't seen this before, and number two, this is not DMX. VMA technology is motion-based, X-ray and MRI are static. The VMA detects ligament instability, MRI and X-ray have difficulty with that. The VMA is objective, and you saw the quantified results down to the 0.5 millimeter or even 2 degrees in angulation, and MRI and X-ray, just not acceptable. It adheres to AMA guidelines and used for case value in PI law. If you're wondering, this technology has already been on the Today Show. On the left-hand side, you see it being evaluated for a patient's lumbar spine. It's already been published in Spine Journal, and in fact won the outstanding paper runner-up in that year for this technology. And on the right, giving you just a better picture of what it looks like. It's a painless test, it's objective, it's quantifiable, it's accurate, consistent, and reliable. And it makes you more marketable when your patients that have been involved in trauma can get all of their injuries evaluated. And it makes you a much better physician if your chronic neck and lower back pain patients now have a way of identifying injuries that other technology may have missed. And in fact, it's been called by Nancy Snyderman the first time we can really see the spine move. It's the technology of the future. Now, when compared to X-ray, the VMA is significant because it can identify injuries with much greater specificity. In fact, regular radiographs miss and underdiagnose spinal ligament instability in a very high percentage. Here's a comparison between X-ray and VMA literature validation. There is an increased measurement variability when relying on the diagnostic imaging for diagnosis, inflection, and extension. The measurement variability was reduced when including VMA. This is published literature in the International Journal of Spine Surgery. Once the injury is identified, there are multiple treatments that are available for your patients. And in fact, the patient will be referred back to you once they've received the testing for their treatment options. This all varies by specialty and the severity of the injury that may have been identified. Chiropractic, physical therapy, pain management, regenerative medicine, and maybe even spinal surgery may be required because of the severity of the injury and, of course, the specialty of the referring provider. Now, the VMA benefits for you and your patients. When you refer for this technology, you're going to be finding injuries that everyone else is missing, which right off the bat is going to make you unique in the marketplace. You're going to have the ability to identify your patient's underlying pain generator, whether it's acute traumatic personal injury type case or chronic neck and lower back pain case. VMA can evaluate both the cervical and lumbar regions without any problem. You're also going to get comprehensive reports and a video that you can review with your patient and show them where their specific pain generator is, the area of their injury, and what you're going to do to get them better. You also benefit from the independent post-evaluation and the validation process. If it's a personal injury case, personal injury is all about objective biomarkers, and this is exactly what the med legal community needs in order to identify their clients, your patients' injuries. You can assist your attorneys that you work with providing them high quality, reliable, accurate, quantifiable medical evidence. And you're going to improve your clinic and your PI case outcomes. The VMA not only measures the ligament in translation, but also angulation, and as you saw, in the disc height as well. Thank you for watching. Your next steps is to contact us right here.